In this video, we will be showing the manual muscle test for the hip adductors. The muscles that contribute to this motion include the gracilis, pectineus, adductor brevis, adductor longus, and adductor magnus. The gracilis originates on the pubis and inserts on the anterior medial surface of the proximal tibia. This muscle is innervated by the obturator nerve. The pectineus originates on the superior ramus of the pubis and inserts on the pectineal line of the femur. This muscle is innervated by the femoral nerve. The adductor longus originates on the pubis and inserts on the middle third of the linea aspera. This muscle is innervated by the obturator nerve. The adductor brevis originates on the pubis and inserts on the pectineal line and proximal linea aspera. This muscle is also innervated by the obturator nerve. And lastly, we have the adductor magnus, which originates on the pubis and ischium and inserts on the entire linea aspera and adductor tubercle. This muscle is innervated by both the obturator and sciatic nerves.
So today we're doing manual muscle testing for the hip adductors. So when the patient is on a table in sideline, you're going to be stationed behind the patient. And to test for a 3, you're going to take the patient's top leg and you're going to lift it up into about 25 degrees of abduction. And you're going to ask the patient to just lift their bottom leg up towards their top leg. Okay, and that would be a test for a 3. So you can go ahead and relax. Now to test for a 4 and a 5, you're going to go ahead and have the patient lift their leg up again, and you're going to cradle underneath their top leg to support along the medial aspect of the knee. And you're going to ask them to lift their leg up, the bottom leg, and you're going to say, don't let me push down. You're going to push down proximal to the knee. Don't let me push you down. And that would be a test for a 5 if they can withstand maximum force pushing down, and if they would break under a moderate or maximum force, moderate force would result in a 4. So testing for a 2, what you're going to want to do is have the patient lay in supine. You're going to support down underneath the ankle to help lift it off the table, and you're going to pull them out into a slightly abducted position. And all you're going to do is ask the patient to bring their leg closer to the midline. So go ahead and bring your leg closer to the midline. And you're not assisting the patient with this at all. You're just bringing their foot up off of the table to help reduce friction. And if you're going to be testing for a 1, you're going to have them out abducted. What you're going to want to do is palpate along the abductors, which is on the inner part of the leg. And you're just going to ask the patient to attempt to bring their leg in. There'll be no movement, but you're just feeling for a contraction. So go ahead and try to bring your leg in. And you would just feel a contraction for a 1. And for a 0, you would have no felt contraction or movement at all. A substitute position to watch out for when the patient is in sideline, if they have weak hip adductors, they are going to try and compensate with their hip flexors, which will cause them to internally rotate at their hip and will have the patient slightly bend into a supine position. So you want to make sure they stay upright in a sideline position when you're testing for a 3, 4, and 5.